Morning
Good
or
morning. Bobby Joe, are one of your clinical conflict weeks next week on exam week?
Let me look. I don't think so. I
I don't
think
think so. I
the
think it
second.
starts the February 6th, I think.
Let me look here. No, it's not until the
Are you the
17th.
third? Okay, all right, we're good. Okay,
I think it's
we're
the
good.
17th is
Okay,
when the first conflict is for it.
okay. I have two other students that have conflicts next week, so just trying to arrange with them, but I don't, yeah, you're not one of them. Okay, thank you.
Yep, no problem.
How's everybody doing for a Friday of week 3?
pretty peachy.
Pretty
Not too
peachy. I
bad.
like it. I like it. I love the name of your Zoom ID. It says the perfect family.
I'm about to change it right now
I
because
don't,
I'm on my
I love
phone.
it. I just don't do it. It's all
Yeah, I'm about to change it.
That's awesome. I love it. Just try to pay attention here to getting everybody in that's in the waiting room.
Do you want us to put our names in the chat?
Yep,
we're
If everybody could put their name and their campus in the chat, I would greatly appreciate it. Yep, thank you. Okay. 1 o'clock for some, 12 o'clock for others, 11 o'clock for me in Colorado. So we'll get started out of respect for everybody's time. How is everybody? You made it through Friday of week 3. How we feeling?
Okay.
Why just okay?
Oh, it's just for me particularly, I have 4 classes this term, so it's just a little
Oh.
overwhelming, and just trying to make
Yeah.
sure I didn't forget an assignment here, or didn't forget to
Yeah.
do something for this class, or so it's just a matter of I'm an organized person, but
4
it's a
classes
whole
is a
different level
lot.
of organization.
Right,
So,
right, right.
I mean, as a whole, I'm pretty organized, but when it comes to something like this, it's a little
Yeah.
hectic and stressful. So, you know,
Mhm.
but I just take it one day at a time.
Sure, sure. Wow. How's everybody else doing? Guys staying organized with all your classes? I know some of you have 1 other class, some of you have 2, and Bobby has 3.
4
Wow.
a lot. 4 I have.
4 is a lot.
Yes. I only have 4 because last semester they dropped us from IV therapy because it was only 3 of us that made it. So
Okay,
that's why.
okay.
We gotta
Yep,
do.
part of that group too. 4 classes.
Oh my gosh, you guys.
Yeah. 4 is a
Wow.
lot, that's for sure.
Okay, so welcome to week 3. We are continuing to cover vulnerable populations this week, right? We talk about the homelessness, we talk about poverty, right? What else are we going to be talking about? They're in your readings. All your readings are in your module this week.
Migrant workers.
Migrant workers.
Mhm.
And who else are we going to be talking about?
Homeless.
Mhm. We're going to be talking about the rural population, right? So all your readings this week are in the module. Okay, there's no book reading this week. Next week is exam week. Okay, so you guys should be well into having looked at your study guide, I hope. After today, the last pieces of the content come together for exam 1, right? Weeks 1, 2, and 3, right? So on your Pardon me?
We did those before through the
Okay. So everything on your study guide, at least the topics and the concepts, should be familiar after today. We've had 3 exam reviews this week. I just finished up my first one a little while ago. We had one Monday, we had one Wednesday, and we had one today. I only had 4 students there. So 3 of them were my students, so I'm appreciative of that. I haven't looked at the attendance from Monday and Wednesday. I do have to look at the attendance on those recordings. Did anybody else attend a live review session Monday or Wednesday? Okay. You do have the recordings, right? I've shared those with you in your announcements. So I would highly encourage you at this point. I'll post my recording from today later on this afternoon after I'm done with class. And I'll post my recording so you'll have 3 recordings. Okay. I would encourage you to watch the recordings. If you can, you should. It's all the same information, but just presented in a little bit of a different way by each instructor. Okay. What else? As far as exams for next week, I'll be sending out emails. You're not a Friday, you're a Friday class, so you'll be taking your exam at this time next week. And I can only open up the exam an hour before the exam to download. So I'll send you a message out Thursday night or Friday morning that the exam's ready to download. So it would be ready to download at noon Eastern next week. Okay. And then we'll be meeting the faculty will be meeting on Saturday morning because we have a late class. We have a late class tonight. Dr. Ford doesn't teach till 9 p.m. So we'll be getting together next Saturday morning, doing the exam analysis, and then hopefully by noon next Saturday, we'll have the grades posted. Okay. As I've said before, the study guide is a good starting point for reviewing for the exam. I've put the study guide together based on your readings, your weekly readings, your weekly notes. Your first 2 discussion questions in weeks 1 and 2 are applicable to this exam. The first week being vulnerable populations, the second week, last week being common childhood ailments. The one thing I will ask you is on the section of your study guide that is common childhood ailments, please focus on that reading for common childhood ailments. In your notes in week 2, you do have all the childhood ailments, but they're really detailed, really detailed. I have summarized the most important points for each childhood ailment in your study guide. So focus on that. Okay. And I will tell you, there's a question on the exam for every childhood ailment. Okay. So please know those. Please know the study guide information on the childhood ailments. Okay, and remember we're moving into next gen. Okay, so we're taking all your critical thinking skills from your previous classes and the first couple of weeks of this class, and we're putting them into practice, right? Clinical judgment. And a couple of students were in my review, so they've already heard me say this. So remember, we're trying to move you into the community setting using your critical knowledge that you have gained, and then taking care of the community, taking care of community patients, clients, taking care of families, taking care of a whole community. Okay. Couple of words I really want you to focus in on for exam review, and it's in your study guide, is resilience. In your study guide. What is resilience? What is resilience? Let me ask you, what's resilience? And why is that important? Anybody know what resilience is?
The ability to recover or like adjust easily to something.
So in the community, we take care of lots of vulnerable populations. A lot of them may have low resiliency, which means what? They're not open to making their situation any better. Part of our job as nurses is to help them with resiliency, because the more resilient you become, hopefully the better, moving towards better outcomes. So in community nursing, us practicing our own resiliency and teaching individuals and families about resiliency can only improve their situation. So that's an important aspect of the exam. The other important word to understand, and it's in your study guide, is motivation. And we talk about motivation this week when we talk about the rural community. How do you motivate? And let's just start there with content. How do you motivate the rural community? I mean, in your preparation for class, what did you guys learn about the rural community? What is a rural community?
I would say a community that basically they lack health and stuff and need help in areas, organizations, and basically needing I guess help like with food and homes and just it's just a poverty level.
Thanks, that's part of it.
The rural community deals with a lot of depression. They have higher rates for depression.
They certainly do.
The population is less focused on health promotion.
Exactly. And what about services?
They don't have health services because they live out far away.
Mhm.
Lack of health services, transportation.
Transportation is big in the rural community, or lack of. Right. So when
And
you're
their finances play a role in that as well.
very high incidence of poverty in the rural community. So if you're a community nurse working in the rural community, you've got your work cut out for you. Okay, you've got a population that isn't typically focused on their preventative care. Okay, and that's where the word motivation comes in. And this is in your study guide in this section. Let's say you were doing a health fair. Okay, let's say you were doing a health fair in your rural community. And you wanted as much participation as possible. How would you motivate the rural community to participate in your health fair? What's important for them to know? And how do you get them there?
Maybe you offer transportation for them to get there.
Come on out with your hands up.
I'm sorry?
Come on out with your hands.
Is everybody okay?
Yeah.
I don't know what that background noise meant. Come out with your hands up. I don't know what that meant. Is everybody okay?
That was my television. That was my TV.
Oh,
I was like, is someone getting arrested?
okay. Okay. All right. Thank you. All right. Let me refocus. That caught me off guard. Let me refocus. Oh, motivating. How are we motivating the rural community to take an active role in their healthcare? Why is that important?
Because they lack health care.
Mm-hmm.
I think a way to motivate them is to bring it to them as well. Instead of having them travel to you, maybe you could travel to them in a sense of, making it more accessible for them.
Okay. Those are all good thoughts. And what I'm moving towards is How do you help them understand the importance of taking care of their health? I mean, what if you do a health fair and you do a screening and they have high blood pressure? How do you then take that to the next step and educate them on the short-term and long-term risks of high blood pressure? Because in your study guide, I'm just going to go to it real quick. When we talk about motivation,
I think one of the things that you have to do is you have to ask them if they even know what it means.
exactly.
Like, ask them ask them questions that would lead you to know if they understand it. And if they do understand it, how much they understand it, so you know what to elaborate on, and where to go from there, so they're not, and then the other thing too is the understanding of the level to talk to them instead of using big words, or make sure that you're talking in a way that they can understand you if they don't understand what it is.
Thank you, Bobby. There's a big issue in the rural community with regards to health literacy versus health illiteracy. Right? Is there a cultural barrier? Is there a communication barrier? Do different cultures prefer to obtain their health care with different practices or different care providers? Okay, so health literacy and health illiteracy is extremely important in your assessment of the rural community. Okay, we know that the rural population is much less focused on health promotion. We've already established that, right? So one of the things, and I'm talking about motivation now, one of the things that we have to come up with strategies for this population to take advantage of with regards to primary and secondary services. So if we advertise a health fair that says, we're going to do blood pressure screening, we're going to do blood glucose screening, we're going to do scoliosis screening for kids, we're going to do, we have a nurse here that's going to be doing vaccinations. Okay, how do you get the word out that all these things are primary and secondary interventions? And there's no right answer, but I just ask you to think about it. How do we motivate this community? There's 4 things to learn, 4 things to know as far as motivation in the senior study guide. How do they feel about, I mean, it's fine to give them free food and free transportation and, free this and free that. But what's most important is helping them understand why health plays such an important role in their quality of life. Okay, so one of the first things is, how do they feel about a health problem? Let's say they have cancer. Let's say they have a high-risk pregnancy. Let's say they have high blood pressure, seizure, epilepsy. How do they feel about this problem? Right? Do they think it's serious? They may not think it's serious. So in your assessment of these individuals, how serious is it? Okay, do they understand the seriousness of it? Right? Do they think that going to the doctor will have an impact? I don't know. How can you convince them that going to the doctor will have an impact? And again, we talk about health literacy and health illiteracy. And then the other thing to think that they think about is barriers. I can't get there. I can't take the time off work. So remember, and we'll talk about the migrants next, but a lot of jobs, a lot of employers, a lot of jobs in the rural health sector, including migrants on the farms, don't have health insurance, right? Or their job is an hourly job, right? Where they get paid by the hour, get paid by the day. They don't have vacation time. They don't have personal time. Right? So if you're asking them to travel to the city for an oncology appointment or a high-risk OB appointment or whatever, they may not be able to afford being able to take the day off without pay. Okay, so again, these are all things to consider with the rural population. Okay, why do you think the rural population is so lackadaisical about healthcare?
Probably if you never had a resource and you don't look forward to it. Like if you're not used to getting checkups, then as you get older, then why would you go get a checkup?
Excellent point. Excellent point. Anybody want to add to that?
Maybe because like the cost of healthcare, they just can't afford it. Some people.
Yep. Remember, a high proportion of rural communities live in poverty.
Some of
Yeah.
it may be a cultural thing as well. And depending on their culture or the, what do you call them? Remedies that they do, that they think that that's going to heal all. So what's the point of trying something new?
Absolutely. A lot of barriers in rural health. One of the things that is a big barrier, a big issue in rural health is we don't typically see these clients until it's either at a crisis level or it's whatever their condition, disease, or screening is at a more advanced level. Why is that? Why don't they come in to be seen? Think about
They don't want
what's,
people to know their business.
Having something wrong.
say that again,
They can have a fear of like something could be wrong.
right? Mm-hmm.
Transportation is limited.
Transportation might be limited,
Very far away.
very far away. We're missing one really important piece to this.
Money?
Money is part of it.
Privacy.
Privacy. There you go. That's the start of it. Privacy. Okay. There's not a lot of anonymity in the rural populations, right? Everybody knows everything about everybody, right? We know that substance abuse, drug abuse, domestic violence, child abuse are all issues in the rural community. There are issues everywhere, but in the rural community, they're higher. So people are less likely to go and seek out services with regards to those kinds of topics because they're afraid shame, guilt. They're afraid everybody's going to know everything about what's going on in their family. And that's a real problem in the rural population. So how can we talk to them about, primary and secondary interventions? Okay. Something they're not really used to, but that's a big problem in the rural communities is usually getting them in when things are starting out. We usually see them when there has been an issue with domestic violence, or there has been an issue with any kind of violence, maybe an overdose with drugs, alcohol. Okay.
Your computer has good volume.
Pardon me? What else do we know about the rural population? Let's think if you were a home health nurse, a hospice nurse, and you had to travel. What kinds of barriers might you face? Pardon me. Traveling up to rural communities. The time it takes to get there, right? Maybe the reimbursement issues.
Yeah.
And it's so far away, like,
So far away. Financial issues of getting there and getting back. And another big issue is internet, broadband. A lot of rural communities don't have stable internet. Right? So when you're trying to do a telehealth visit, that may be limited. So you have to go in person. I mean, think about it. Does anybody live in the rural community or have relatives or friends who live in rural America? Nobody?
Where would you consider that?
Well, what's the definition of rural?
Like a country place?
Yep. So, for example, tomorrow I'm traveling up to, or Tom and I have a lake house. I don't know why we're going tomorrow, but it's freezing up there. It's like a frozen tundra, up in Northwest Wisconsin. Okay. Way, way, way up north. Okay. Very, very rural. There is nothing up there. Okay. We have to drive long distances everywhere, whether it's a grocery store or we have a medical appointment or there's no specialists up there. So they have a little clinic, with a family medicine doctor who is the screening for everyone. Then he decides where you might need to go from there. Very limited resources. Okay.
My mom lives in Roswell, New Mexico, and that's how it is.
Yeah. The other issue in rural communities is workforce. It's really hard to recruit and retain healthcare workers in the rural community. Okay, so the less healthcare workers you have, the less services you have. If clinics close down, if hospitals close down, it just decreases the services that these people have. Very increased levels of chronic diseases in the rural community. And we know why, right? They don't seek out primary preventative care. And we can barely get them to get screened, which is why I asked at the beginning, let's say you're hosting a health fair. How do we get them there for some screening and some education? Okay. Let's move into the migrant farm workers, which are typically a part of the rural population. Where might a migrant be working? On a farm? Where else?
in the industrial plant or something like that.
Industrial plant? When you think of a migrant worker, what do you think of?
Someone who's like out in the fields or someone who's working in like chemical plants or manual labor all day.
Where do they typically come from?
Like other countries.
Other countries.
Okay. So do you anticipate there might be some language barriers?
Correct.
Do you anticipate there might be some cultural barriers?
Yes.
What if they bring their family along and you have a whole family unit now? Mom, kids. Let's say the kids are working out on the farm alongside their parents. These people don't have health insurance, or some of them do qualify for health insurance, but it's usually subsidized. These people don't have a lot of money. They live in poverty. They may live in very crowded housing situations, which is a breeding ground for what? Unsanitary cases, tuberculosis. Yep. What happens? What are the risks of these migrant farm workers? What's the number one risk for, and this is all in your reading, what's the number one risk for migrant farm workers?
Diseases.
That's one of them. Infectious diseases,
Sexual
communicable
harassment and
diseases.
abuse.
Domestic violence.
Domestic violence is up there. Chandra,
Sexual
what did you
harassment and
say?
abuse. Sexual
Sexual
harassment.
harassment and abuse. What about pesticide exposure?
Mhm.
That's big. That's one of the biggest risks to migrant farm workers. Okay, and what if their kids are out in the field and being exposed to pesticides? Let's come up with a primary intervention for migrant workers exposed to pesticides. Okay, what would be primary? What would be a primary intervention you could do with the migrant farm workers when they first arrive?
I guess you could inform them on how to, I guess, to use the mask. They might have the respirator mask or something that they could use to prevent it for them from inhaling it.
Excellent. What else?
Maintain good hygiene.
Maybe warning him about the signs of pesticide exposure? When to seek help? Right? What kinds of screenings can we do for this population to see the level of if they've been exposed to pesticides?
Is that the normal like blood pressures and temperatures? Eye checks,
Breathing.
their breathing. Yeah.
Can we be asking the owners of the farm to tell us about what kind of pesticides they use and what times of the day they use them at and what they do for workers if they think they've been exposed? That's all appropriate, right? And then what are some tertiary interventions? What does tertiary mean?
Treatment.
In this case, it means they have been exposed.
So you
Right?
probably would give them some type of inhaler or something like that, maybe antibiotics or something.
What might they present with for pesticide exposure? This is in your reading. And this is also in the study guide. You have to be,
And what was your question? What was your question?
Gastroenteritis, hepatitis.
my question is, we're in the tertiary intervention mode now, which means we're talking about pesticide exposure. And the reason why we're talking about pesticide exposure is because it is one of the #1 risks of migrant farm workers, pesticide exposure. So if we're in the tertiary level now of intervention, that means that they have had an exposure and they're symptomatic. And now they're coming to you for treatment. What might they present with?
Cough.
Maybe some GI
TB.
symptoms?
Yeah.
Tuberculosis.
Hepatitis.
Well, they may not present to you with tuberculosis, but
I would say nausea and vomiting.
would you want to screen them maybe for tuberculosis?
Yes.
Sure. Nausea, vomiting, diarrhea. You're going to get asked about pesticide exposure on the exam. That's why I'm covering it. Okay. Because if our concept here is rural populations and migrant farm workers, and we're the community nurse, we need to be ready to jump into action with our clinical judgment if we're working with this population. And what do we do with this population if they are indeed exposed? What about I'm thinking of some other health risks. What about accidents?
Heat exposure would be one.
Yep, we're going to get to that. Heat and cold exposure. So we'll jump back to that. What happens with heat exposure? These kids, these families are exposed to heat or cold all day long, out in the sun all day long.
With the cold, you can be frostbite.
Frostbite,
Yeah.
respiratory issues,
Yes.
skin issues with the heat, sunburns. Migrant working is a very, very challenging job. Okay, so we've got pesticide exposure, we've got heat and cold exposure. What about injuries from, I don't know, musculoskeletal injuries from bending and lifting all day? What about injuries from equipment? Injuries from hand tools they might be using. What else?
Urinary tract infections or other infections
Due to?
lack of facilities for the bathroom.
Exactly. Unsanitary conditions. A lot of these people work in very unsanitary conditions. We talked about it earlier. They also live in very unsanitary housing, have very unsanitary housing. Lots of people crowded into one small place. And again, you may never step foot in a rural community. You may never be a community nurse in a rural community, but rural migrant farm workers are part of the rural community. Okay. Everybody make sure they're on camera. Tiona, I'm looking at your ceiling. I don't want to be the camera enforcer. I really don't. Okay, I just want to peek at my notes here, make sure I'm covering everything. Okay, we talked about communication barriers, housing, poor quality, crowded places.
If they're undocumented, that might cause a fear.
Yep, thank you. Thank you. I was going to get to that. If they're undocumented and they need health care, might they just blow off getting health care because they're afraid of their immigration status might be questioned?
Mm-hmm.
Another big challenge in the rural community. Transportation, we definitely talked about. They're not covered, obviously, by employer health benefits. And the interesting thing to know, too, and remember this, write this down. It's on your study guide, but immigrant workers are not eligible for the WIC program, Supplemental Nutrition Assistance Programs. They're not. So if you get asked about that, you know, what do they qualify for? Maybe they qualify for some kinds of health insurance or some kinds of subsidies for health insurance or food assistance. But migrants specifically are not qualified for the WIC program. And there's no way they can qualify for the WIC program. So please remember that. Okay. Let's talk about, okay, anybody have any questions about rural populations, which include the migrant farm worker? All right, let's move over to another kind of hard topic to talk about, which is homelessness. Okay, we all probably live in a different zip code. Is there anybody here that has a community, that lives in a community that doesn't have homeless population? What do you think? What do you think when you're driving down the street or walking your dog or taking a walk in the park or wherever, getting around your community and you see homeless people? What do you guys think about? What comes to mind? And some of you may have previously been homeless or are home.
It's sad. There's a guy, when I drive past there, it used to be a facility, and he sleeps out in front of the facility. And he was out there during the winter time.
You think about things like, gosh, how did they get here? What drove them to be homeless? Where's the family? Why can't anybody support them? Why can't anybody take them in? What did they do to cause this? I mean, everybody has their different thoughts, right? Homelessness, homeless people, homeless families are part of our community. Okay. So first of all, let's start out with cultural sensitivity, empathy, compassion, right? We need to really think about our own beliefs and our own values. You know, are we adequately able to care for this population? Right? And caring for the homeless population is a multidisciplinary team. Nurses, doctors, social workers, psychologists, pediatricians, family doctors. Okay, and we know that the homeless population is increasing exponentially, especially since the pandemic. I saw this in the schools. They estimate that over 600,000 people may be homeless on any given night in this country. And the other estimate is that 1/3 of that population are families. Okay, I saw this in the schools over the pandemic. Many, many, many families became homeless that were otherwise not homeless. Okay, whether it was parents losing their jobs or parents not having to go to work because they had to stay home with their kids, many, many reasons. So homelessness is increasing exponentially everywhere we go. A lot of you did your week 1 discussion question on the homeless population. Okay, so, and a lot of people do actually do their vulnerable populations assignment that's due in week 10 on the homeless population. So if you started out by doing your first discussion question on the homeless population and you want to continue that research into your vulnerable populations assignment in week 10, please feel free to do so. I would say that's probably the highest vulnerable population that people do research about. What kinds of, why do we think people are homeless? Maybe loss of job, traumatic event in their life. What else? Why are people homeless?
I would say the choice of drugs.
Substance abuse.
Substance abuse.
It's not.
Cheyenne, you're kind of echoing when you can put it in the chat, put your answers in the chat.
Sorry, we all have different computers in this.
No, that's
room.
good. I can hear you perfect now. What were you saying? What else? What other reasons? What about disabilities? A lot of people that are homeless have disabilities and they're unable to get a job.
They're veterans that don't know where to go, don't know the resources that's out there for them to help them.
Yeah, veterans. Big homeless population, big part of the homeless population. What else?
Mental illness.
Support.
Mental illness, I heard. Not having support, I heard. Absolutely. So what can we do? Or no, let me take that back. What kinds of health risks do we think are associated with homelessness? First of all, I'll ask the question, kind of like the rural population, are they into their primary care?
No.
No. So what happens? What happens?
They just don't take care of themselves in that sense, like their health declines, infections happen, increase.
Mm-hmm. Yeah.
If I remember correctly, TB is one of the most common in homeless individuals.
Close living quarters, spread of infectious disease, communicable diseases. The homeless population has a lot of chronic diseases, right? They don't seek out the care initially. Okay. kind of like the rural population. We don't see them until they're well advanced into their condition or disease or issue. Right? Diabetes, heart, diabetes,
Cardiovascular disease.
pardon me?
Cardiovascular disease.
Cardiovascular disease, diabetes, substance abuse, alcohol abuse, mental illness. Okay, so if you were part of a team working with the homeless does anybody work with the homeless population in any capacity? If you were part of a team that was caring for the homeless population, what would be let's say in your initial contacts with this individual or the family, what would be the most important thing to develop?
Trust.
How do we do that?
Have a non-judgmental attitude.
Maybe let them tell their story. Ask them open-ended questions, not be judgmental. Empathy, compassion.
I have a lot of survivors of human trafficking, and a lot of it stems from the substance abuse. So yeah, it's a lot of being non-judgmental, open, and a lot of support.
Yeah. Yeah. Excellent. And so once you can establish that trust, well, let me talk about families. Once you establish that kind of trust, maybe moms would be more willing to let you schedule an appointment for their kids for a checkup or for immunizations, right? Once that trust is established, hopefully getting some insurance, getting them the resources they need. What kind of resources might they need? They might need substance abuse treatment, alcohol treatment. Kids might need some services. I mean, homeless kids are extremely at risk, right? Therapy, trauma, counseling, absolutely. They may have PTSD. They may have had a previous TBI. Who knows? What else do we think about with homeless? Where do we usually see them when we care for them? Where do they usually show up for care?
The ER.
They usually show up in the ER, which is a whole lot more expensive than treating them locally in the clinics or with appointments or the local resources they might need. Right? What else about the homeless population?
I think kids are more susceptible to being kidnapped or put into trafficking.
Mm-hmm. Kids are more, with those, in addition, kids are more susceptible to behavioral problems, academic problems, mental health problems. Violence is really big in the homeless population. Child abuse, domestic violence, violence in general. Okay. So there's a section in your study guide about the homeless population. And then the last topic I wanted to cover was poverty. What is the biggest impact on family health?
Finance.
Absolutely. The financial stability of a family impacts their entire life. It impacts healthcare, impacts resources, impacts education, impacts trying to provide the basic needs for your family, housing, food, clothing. Okay. A lot more people and families are moving below the poverty line since this pandemic. It continues to increase. And so if you're working in the community, you're most likely going to be working with a lot of people, a lot of families, maybe a lot of communities in general that live in poverty. What if you're working in a community with a high crime rate, high gang rate, or gang activity? How do you help move people out of poverty? Especially kids that live in poverty. Well, kids are just in general an at-risk population, right? So then you put a kid in a living situation in poverty, and what happens? They might have a lack of access to healthcare, lack of access to education, lack of access to basic needs. What else do you think about when you think about people or families or individuals in poverty? What kind of health risks do they have?
I think they would have pretty much the same health risk as across the board with all of these groups because they just don't take care of themselves. I mean, with the lack of funds, they're not going to go to the doctor or even the ER. They may not unless it's that serious.
Mm-hmm.
So you would have a risk of infection or, you know, cardiovascular disease, any of those really across the board, you would still have the same risk of.
Mm-hmm. I see a couple of comments about nutrition. Nutrition, malnutrition, very at risk, especially for the kids. You see it in the schools all the time. And that's why so many programs to help these kids in school. I mean, sometimes these kids, when they get their breakfast and lunch at school, the only 2 meals they get during the day. As community nurses, we need to know our resources for these kinds of families. Okay, we need to do our best to get these, especially these kids, into regular appointments. A lot of times the only health care they may get would be during the school day, going to the clinic, complaining of a stomach ache or whatever their complaints are. That's it. They're not going to see a doctor after school. Whatever the nurse does in the schools to assess the situation, that's the health care they're going to get. You can call a parent and say, hey, I think your kid needs to be seen. And they may say, I don't have any insurance. I don't have any money to go to the doctor. And you tell me what I need to do. And that's it. That's all it's going to happen. So families living in poverty it presents quite a challenge to the community and public health nurses as well. Now, what if a parent's been diagnosed with cancer? What if parents have gotten divorced? What if there's been a significant medical event and has impacted them financially? Or if they have kids that are involved in drugs and need resources? A lot of reasons that families and individuals go into poverty. What else can you think about that we could do for families in poverty? That's where resilience comes in. At the very beginning, we talked about resilience. How can you help these families realize that they can move themselves maybe out of poverty? How do you instill resilience in them and motivation in them to want to do better for both them and their kids? And there's a group of people that don't. They don't want to be resilient. Self-worth. Exactly. Help them with self-worth, self-confidence. Right? There's a lot of struggling families, a lot of struggling individuals. Okay. Questions about those 4 topics: migrants, rural, homelessness, and poverty. Why doesn't everybody pull up their week 2 quiz? Oh, week 3 quiz. Wait, week 3. So week 3, quiz 2. I'm pulling it up as well. Hang on. Everybody have it ready?
I don't need.
Okay. Week 3 module. Hey, tell me when you're ready.
I'm not there. I'm coming. I'm sorry.
All right, no worries.
Ready.
Okay. Okay, somebody read question number 1 for us.
What should the home health nurse anticipate about the clients in a very rural community? They will be more likely to have complex chronic illness. Is my answer.
That's your answer. Does anybody have a different answer? What's wrong with the second answer?
Most of them have
They don't have
provided
insurance.
They don't have the insurance.
Right.
They don't have employer insurance.
Right. Why is C wrong?
Because they will be.
They will have chemical exposure.
Yeah.
Yep. And then why is D wrong?
They don't have insurance and they don't have access.
So they don't have the physicians.
There are hardly any physicians.
Yeah.
Right? I mean, they may have a family, like I said, a family doc or a primary doc that takes care of everybody in the community. But as far as access to other physicians, they're going to have to travel for that if they're having health issues. So A is the right answer. Okay, somebody read us question number 2.
The nurse is developing a primary prevention program for members of a rural community. Which intervention is appropriate?
What's the important, what are the important words in that question?
Primary.
Primary.
Okay, so now we're looking for primary. So if you see D, if you look at D, if you read through all the answers and you see D first, could you just cross that out immediately?
Yeah.
Yeah, because that's tertiary.
No.
That's secondary because
Right.
it's screening.
Screening.
Yeah.
And what about C? How can you rule out C right away?
Because they already have a disease.
Because they already have diabetes.
Exactly right. So there's 2 that you can eliminate right away. What about A? What's wrong with A? It's screening. And what's screening?
Secondary.
Right. And do we all agree that B, providing information on minimizing excessive sun exposure, is a primary prevention?
Yes.
Yes.
We're trying to prevent something before it happens.
Yes.
Okay, good. Okay, somebody read number 3.
A migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and cough. Which nursing intervention is appropriate?
I would say ask the farm worker if they apply chemical pesticides at work.
Okay, yep, that is the correct answer. Why is A wrong?
Because you don't know if it's conjunctivitis.
Exactly. You don't know what it is yet. And why is C wrong?
Because
Because
you'll
you
know
still
what
don't
it
know
is
what
and
it
how
is
to
yet.
work in the history.
Exactly. And why is it a little bit too soon to do D?
Because you don't know what the disease is, you don't know what they have.
Well, yeah, and think about it. When we think if a migrant farm worker presents to you, we know that the biggest risk they have is pesticide exposure, right? Those are
Yes.
symptoms of pesticide exposure, right? So
Mhm.
we would start, I mean, the simple fact that they're a migrant farm worker, that's number one risk. Then they are complaining of eye irritation, throat irritation, and cough. That's symptomatic of a potential pesticide exposure. So that's why B is correct. And question 4 follows right along with this. Somebody read question 4, please.
During a home visit, the nurse notes that a migrant farm worker family is living in a small house with several other families. Which nursing assessment is priority? D.
What's the important word in this question?
Priority.
Priority.
Priority. Right? So what's the right answer?
D.
D.
D, as in
Why?
dog.
Why?
Because if they're living in a small home, it could be I don't know.
They're
Could it
migrants.
possibly be A, because it's access to and consumption of nutrient dense foods? So wouldn't them having nutrition be one of the main concerns, a priority concern at this point?
Okay, let's think about it. This is a good question where all the answers look okay, right? They look okay, but it's asking which is the priority. So knowing that they're migrant farm workers living in a small house with several other families, what is the priority first?
It would be easier to pass around TB because
Correct.
people
Yeah.
live in our community.
To find out all the family members that are having symptoms, so that's why you would do the screening questionnaire.
Great.
Yes. That's
And
what I
then
think.
A and B will come down there if we need it. Or A. Oops, you guys still there? Okay. So do we understand why? Sorry about that. We bumped out for a minute there. So do we understand why D is the correct answer?
Yes.
Yes.
Okay, let's go to number 5.
Which statement reflects the impact of income on healthcare outcomes? I think is low income increases the risk of chronic diseases. I mean chronic illnesses.
Does anybody have a disagreement with that?
No,
Why is A wrong?
No, because low income doesn't guarantee you access to Medicaid.
That is
You
correct.
just said like rural areas don't get proof like WIC and other programs.
Correct.
Migrant, sorry.
Yep.
My bad, Miss Lucy.
Yep. Good job. Why is B wrong?
Because just because you have a higher income doesn't mean that you're not gonna go to the doctor as much.
Exactly. And then why is D wrong?
because I guess if you have a high income, you will go to the doctor.
High income does not improve health outcomes. Well, it might, because you might have the access and the financial support to maybe get to specialty doctors and get specialty treatment, So I would say that, high income could improve health outcomes, right?
Yes.
Okay, let's move to number 6. Somebody read number 6.
What should the nurse anticipate for a family living just above the federal defined poverty line?
What do you guys think here?
I would say A.
What do the rest of you
And
think? If you're living just above the poverty line, you're not necessarily really out of the clear yet, right?
yes,
It could be D, because if you're just so out of it, nothing may change.
Okay. I would look at A.
Yeah, I think it's A too.
What do you guys think about A?
I think it's A because like they just above the poverty line, but it don't necessarily mean that they have a lot of community resources because they over the line, but they like just above the line. So
Okay. Okay. Number 7, who wants to read number 7?
Which client is at the highest risk for adverse health outcomes related to poverty?
Okay, which is it? What's the important word in that question?
Highest.
Highest risk.
Highest. Okay, so you have to look at all, they all may be at risk. This is one of those questions where you look at it and go, well, you know, everybody's at risk. Go back and read the question. It says, who's at the highest risk for adverse health comes?
I would say D. 44-year-old male working on a farm.
Okay, they have risks. Okay.
I think it's A because they don't have any medical insurance.
No medical history.
It's
What
a
about
medical history.
No medical history. I'm sorry. So that means they really haven't been to the.
I would say the 68-year-old with type 2.
I would say maybe.
I said the 68-year-old as well with type 2.
Why?
About the 19-year-old with asthma,
Because you could die
breathing
from an
problems.
asthma attack.
Remember, all these are at risk. We're asking which is the
But the
highest.
19-year-old, it says that he has a history of asthma. So who's saying that his asthma is not controlled? He just
Yeah.
has a history of it. The
am
68-year-old female with type 2 diabetes, she's being, or I guess you want to say she's being treated, or she's getting treatment for, or you don't know if she's getting treatment or not for it, or she's taking care of herself.
Yeah, because she's not getting her.
But you don't know. It just says that she has it, but who's to say that she's getting treated for it, because she is low in a poverty stricken area. She might not have the necessary stuff to the things to get that she needs to get treated for that.
Okay.
That's why I picked say that one.
But how do you know all that? Did the answer give you all that information?
It just says that it's her it's adverse health outcomes related to poverty. So I would just assume that.
Okay.
I would say the farm worker because the rest of them not really stating that the rest of them are in poverty, and you're looking at most of the time that the farm worker, the migrant farm worker, is in poverty, but not saying that the 68-year-old, just because she has type 2 diabetes, not saying that she's in poverty, and the 19-year-old not necessarily saying that he's in poverty, that because he has the history of asthma, and also the 15-month-old baby. So that's why I chose the farm worker.
He's in poverty.
What do we think about the 15-month-old without a medical history?
How do we know if the baby hasn't had any vaccinations?
We know nothing about this baby. I'm gonna go with A because it's asking for highest. Because we don't know that the type 2 diabetes lady is not under control. Right? We don't know that the 44-year-old male working on the farm, he may be fine. He may have pesticide exposure, but he has been taught how to minimize that exposure. Okay, somebody read number 8.
Which would the school nurse expect for an impoverished adolescent?
Okay. Why is A wrong?
Because it says the reduced risk of unintended pregnancy. So she wouldn't have a reduced risk. She'd be a higher risk for unintended pregnancy. I chose B. Increased
Okay.
risk of dropping out of school.
Okay. All right, before we go back to that, which is the correct
it's
answer, let's
two.
go to why C is wrong.
Because she wouldn't have any coping mechanisms, like she wouldn't have the resources for that, you know.
And then why is D wrong?
And they probably wouldn't be at school like often.
Activity.
Why is B the right answer? What does your readings tell you about adolescents or teen pregnancy, adolescents?
Well, they're at a higher risk for dropping out of school to begin with.
Correct.
Yes.
Right. And why do we want to keep this population in school? Because your readings say that the more education you can have, the better informed you are and the better decisions you can make. Okay, and the same goes with a teenage pregnant client. One of the goals, the primary goal is to keep that teenage mom in school. Right? The longer she can stay in school, the better chances for a better outcome for her and the baby. Okay. All right, question 9.
Which client is at the highest risk for homelessness?
I think it's B.
Think it's what?
I think it's B.
D as in dog or B as in
No,
boy?
B as in boy.
Okay, why?
Because number one, they're living alone. So like they don't have anybody to help them. So, and it's like they're a veteran and they have post-traumatic stress disorder. So they may be not able to work. So like, I don't know if they have the skills to like keep a job, like if they could keep a job because of the post-traumatic stress. So they probably won't have any income.
Right. They do have PTSD. They might have some depression. They might have some suicidal ideations. Who knows? This is a good question that if you go to the answers and they all look like they could be the right answers, that you missed a word in the question, which would be what?
Highest.
Highest.
Risk.
Sure, an adolescent with substance abuse addiction and a supportive family. Yeah, that's great. They have a supportive family, but they're at risk. An adult with schizophrenia living in a group home setting. Yeah, they're living in a group home setting, but they're at risk. Older child with a history of suicidal ideation. Sure, it's a history of, but those can come back at any time, right? They're at risk. So all these 4 are at risk, but the question is asking who is the highest risk, and that would be the veteran. Okay. And then last question, number 10.
The nurse is working in an outreach clinic at a homeless shelter. Which client should be prioritized?
Okay, she's working at a homeless shelter. What do we think about? What needs to be prioritized? I need to reword this question. Could be A or B. All my classes keep going back between A and B.
I would say A.
I would say A just because of the high risk of TB or hepatitis.
Exactly. That's the right answer.
Yeah, and then the weight loss. Yeah.
That's the right answer. I mean, B is definitely of concern, right? because that may be symptoms of an infection, but they're symptoms of, all right? We don't know yet whether it's an infection, but they're pretty big symptoms of. Okay. I mean, again, another question with all of these are concerning, right? But the question is asking who needs to be prioritized. And you're right. The location gives away you're in a homeless shelter. So what is there an increased risk for? TB, what are some signs of TB? Night sweats, unexplained weight loss. Right?
Yes.
Yep.
Okay, so how'd we do? Did we get a 10?
Yes.
Don't tell.
Yes.
Yes.
Everybody needs to submit this today. This is part of your attendance. I can't have any zeros for the quiz.
Is this how
Okay.
some of the wording is worded on the exam?
What?
Is this how some of the questions will be worded on the exam? Or kind of like around the area of the questions?
Mhm. I mean, think of the quiz we just did. The quiz we just did was clinical judgment, right? Based on the knowledge we have of the homeless population, the migrant population. Those were clinical judgment questions. Okay. So if you guys go back to your HESI prep assignment, and I need to make crystal clear. I gotta make sure you guys can see this. Can you see this? Wait, where I have a
No.
different. Okay, I'm right there. Can you see that?
Yep.
Yeah.
Okay. This is the version that everybody should have. See the directions? It has a whole paragraph.
Yeah.
Okay, that's the version you should be working on. Okay, there is a version in week 9 when the assignment is due that has a link to the prep guide. I told you in week 1 to ignore that one, right? And I sent you an attachment of this updated one. Okay, so everybody should be going from the week 1 HESI prep study guide I sent you. The reason why I say this is because if you've gone to week 9 and printed it out, it's too long of a version. Okay, I cleaned that version up. Okay, because I looked at what topics were being covered on the HESI the last 2 terms. Again, like I've told you, I don't know the questions, but I know the topics. And I cleaned up that HESI prep study guide, and those boxes in the week 1 attachment are what was covered in HESI. The one in week 9 is an older version. I thought it was going to be removed from the module, but it didn't get done. That's why I tried to give this to you in week 1. So please make sure that you're going with the week 1 version. It's a very focused and narrow summary of what topics, what 55 topics were covered in HESI. Okay. And so by looking at that this week, based on weeks 1, 2, and 3, you should be able to complete 1, 2, 3, the 4th section, which is on page 2. It's called Health Promotion and Teaching. You should be able to complete that section. And I even made it more specific. Like if you look under Health Promotion and Teaching, it says the first bullet, first box is preventing health problems. There was a question about infant death rates. I don't know what the question was, but it was asked about infant death rates. There was a question about lipid screening. So I'm just trying to get specific for you guys. Recognizing the second bullet, recognizing alterations in health. There was a question about conjunctivitis. There was a question about diabetes. There was a question about eczema with school sports. So I tried to really narrow it down for you guys. Okay. And this isn't meant to be kind of a pain in the butt assignment. This is meant to be kind of, this is your HESI study guide that you're going to be using at the end of the term when you study for HESI. So wouldn't it be great if it was all filled out by the time you got to week 9? And then all you have to do is study it versus fill it out. So I don't know who's keeping up with it and who's not. I'm just trying to keep up with it with you. So that section, the health promotion and teaching, you should be able to go through and complete. And then the last section on the HESI prep is the vulnerable populations. You have several boxes with different vulnerable populations. Don't make this a difficult assignment, okay? I've been getting emails from students. Do we need to write in this and this and this? You need to, the directions say, just look at the nursing, think of the nursing process. So based on bioterrorism, I think the first box is anthrax. Think of the nursing process. Okay, assessment. What might they present to you with anthrax exposure? And then how might they be treated? Okay, don't make this difficult. I want you to have a basic understanding of each of the topics. Okay. So think, I don't think in every box you have to do A, D, P, I, E. Just think through nursing process as a whole, from start to finish. What would you, if you were taking care of an anthrax patient, what would you want to know? Would you want to know the signs and symptoms of it? Would you want to know the medications they're treated with? Same with Ebola.
So like for your infant death,
Mhm.
would you just put in there like how we would handle it, like what we would do?
Well, what do we want to know about infant death? Oh, it says Bobby, it says infant death rates.
Oh, I missed that part. Okay, never mind.
Okay. That's okay. That's okay. So what are they asking about infant death rates? I don't know the question, but I know they asked something about infant death rates.
Okay.
Lipid screening. I don't know what they asked, but you probably want to know, what is lipid screening done for? How is it done? Through a lab test? I don't know. I'm just trying to help you guys prepare for HESI, and we're preparing the whole term. Okay, so there's 2 full sections of that HESI prep that we've covered in weeks 1, 2, and 3. Okay.
Yes.
Is that helpful? Again, you want to have a blank document in Saturday of week 8. You just don't. It's going to take you more time to complete. It's going to take hours to complete it because you have to go back and what week was this covered? What chapter was this covered? If we can break it up in small chunks, we can get it done. Okay. So by my study guide, we have covered vulnerable populations. We have covered the school nurse. We have talked about infant and child safety. Definitely covered all the common childhood ailments. Today we covered the migrant worker, the rural population, homeless population, the challenges of people and families living in poverty. And that's what your study guide is all about. And I'll say what I said in my review this morning. You know, the study guide is not intended to memorize. It's intended to apply. Okay, you should have a good understanding of the study guide. Okay, now it's time to apply it to clinical judgment scenarios, just like we did in the quiz today. Okay. Did everybody put their name in the chat? If you haven't, please do. Does anybody have any questions? I really like this format of just staying on and engaging with each other and participating. What do you guys think?
I think it helps a lot to hear everybody else's ideas and what they're thinking.
Yes,
It helped me a lot. I know.
me too.
Yeah, I mean, you know, pulling up PowerPoints and this and that. I mean, you guys have all that. I mean, the expectation is whatever I send you, notes, PowerPoints, readings, you're kind of supposed to do that. That's kind of your due diligence. You're supposed to do that. And so when we come to class, I like to just review the content, review the topics, and talk about scenarios. The ones, just want to give you, please be careful on the exam of positive questions versus negative questions. Okay. Let's think about this. You're going in to do a home visit, and the job today is to educate educate parents on they smoke. It's a smoking house. Okay. Your job is to educate the parent on how this puts your 3 children who have asthma at risk. That's your job. You're going to educate. Okay. Positive question. After reviewing the teaching with the parents, mother states that, no, let me think about it. After reviewing the teaching with the parents, what are the following answers suggest that the mother understood what you were teaching her? What are we looking for? Something she says that you know she understands, like, I can't smoke in the house anymore. I have to go outside. I need to quit smoking. What are the resources what are the community resources you can get for me to quit smoking? I won't smoke in the car anymore. Those all tell you that she's moving towards, okay, I get it. Right?
Mhm.
Negatively worded question, same scenario. After finishing the teaching with the smoking mother of 3 kids with asthma, what does she say that requires you? What does she say that you know requires you to do more teaching? So she's saying something wrong, right? Does that make sense? Oh, I went from 2 packs to 1 pack. I vape. Right? Do you guys understand the difference?
Mhm.
You have to be able to pull out positive versus negative questions. Okay? There's both. There's both in the exams. Positive is good, negative is bad. You're mentoring a CNA, or you're mentoring a new nursing student, and she's doing discharge planning with a family of a patient that just had a stroke. Positive. What did the wife or whoever, the caregiver, what did the caregiver articulate that you know she understands the risk of falling at home? All right. So you're looking for a good answer. I need to move the mats out of the bathroom, whatever. Negative. What did the caregiver state that you know requires more teaching and education? So she stated something that was incorrect. Make sense?
Mhm.
So you guys have to be able to read the questions to pull out positive, negative. Do not change your answers unless you're 100% sure. 100% sure that you have the wrong answer. I think I heard it somewhere. I think I read it somewhere. I think she said it somewhere in a review. That's not good enough. You need to be able to 100% convince yourself that you have the wrong answer. Okay. I always like the idea of looking at the question without looking at the answer, see if you can come up with your own answer. Then when you come up with your own answer, go look and see if that's one of the answers. Try and formulate an answer in your head. And then my last tip, a student gave me a couple of terms ago, didn't give me, but gave her class, was she used the highlighter. Okay. And when she read through the question the first time, she highlighted a word that jumped out. Priority, highest, lowest, greatest, first, initial, whatever the word is. and she highlighted phrases that were positive or negative. So that when you went back to read it a second time, those stuck out. She also put a line through the answers that were incorrect to try and minimize the number of answers you were finally looking at. And then if you've diligently prepared for the exam, you should go into the exam confident, not like, holy crap, I don't know any of this. If you've prepared for the exam, then you should go in feeling, I got this, I know this. So, but it's all in your preparation. Okay. Does anybody have any good tips that they do for test taking strategies for the rest of the class? I always like students to share with each other what they do. The other thing about the study guide too is I don't care if you guys work in groups. If you already have a study group you do on your campus, work in groups. Okay, this is not
Tell
meant to
something
be.
that I do.
Oh, go ahead, go.
So I take the study guide and I take notes on the study guide and like highlight key points that I think are important. And I record me going over them. So like when I'm busy or if I'm in my car, I listen to it over and over and over and over again.
I like that.
And like whenever I'm someplace, I'll just be listening to it in my car. If I have a long ride, I'll listen to it. And anytime I'm busy doing something else to where I can't sit down and actually study, I have my headphones in and I'm listening.
That's a great idea.
Yeah, that's what I do.
I like that. Okay, my friends.
I have a question.
Oh yeah, go.
Okay, about this week, it's in week 10 actually. The vulnerable populations, we're just picking one, doing it ourselves.
PowerPoint. Read the guidelines, they're all in there. Yep.
Okay, because the other ones is it like a group activity, but we are doing it ourselves.
The group activity, I'm going to send you out groups. You'll have groups by the weekend. It's a week 7. When is it due? When's your group assignment due?
It says week 10.
Okay, week 10. So I'm going to send you guys out the groups. I'm going to send you out. You're going to tell me what infectious disease you guys want to do as a group and research, and that's a group paper. You all submit the same copy. Right? Everybody submits. There's 4 in a group. Everybody submits the same copy. So I realize there'll be multiple versions, but if you don't submit, it doesn't go into the grade book. I don't have a submission for you. So everybody has to submit. And then your vulnerable populations is individual assignment.
Yeah, the group project is listed under week 7 that says due February 23rd.
I thought it was in week 7.
Yeah, the group project is listed under in week 7. The one that's in week 10 is the vulnerable
populations. And your HESI prep is due in week 9. That's why I say get working on these, because once you get to week 9, it's going to get busy.
So the group one, we will all have to work on it together.
Yep. Just take a look at the guidelines. I'll send out. You don't have your group yet. I'm going to send those out.
Okay.
And then I'll send out the group emails. I'll send out the class emails. Okay. So you get in touch with each other and you work on, I'll probably just assign infectious diseases. So yeah, I'll get that done by the weekend. Okie dokie. Anybody have any questions? Other questions? Great questions you guys are asking.
I do have a question because I know I sent you an email about it, but maybe somebody in the class can help. I
don't
know how to access my NCLEX questions. Normally I go through the student resources in the module, but there's not an option for me to do that under community.
How are you guys getting your NCLEX questions done?
If you have any other classes, you can go to that other class and go to resources and do it that way.
It's also or you can just go to the Evolve website. I go through the Evolve to get into mine.
Well, I went to the Evolve website, but I don't know how to access the NCLEX questions.
You just click on where it says the Saunders. It'll pop up like the book at first, but then it'll go to the actual questions where it says exam, practice questions, and all that stuff. Or at least
Or
that's
you
how
can
I
go
know
to,
that's how
I've
I
already
do it.
put, I've already put a ticket in, but I don't think it's gonna get corrected till next term. So in the meantime, you can go to another class under your student resources,
Okay.
okay?
Yeah, that's what I do. Yeah.
Okay, I'll just do that because I'm on the Evolve website now and I still don't see where to access them, but that's fine. If I can go through another class, I'll do that. That's fine.
Okay, guys, I'm done. Have a great weekend. You guys know where to find me. I'm traveling tomorrow, to the tundra. But I should be available late afternoon, early evening. We've got a morning flight and all that. So, if I don't respond, you send me something out in the morning, and I don't respond, it's because I'm traveling. So I'll be back in touch later out in the afternoon or in the evening,
Thank you.
but I will respond.
Thank you.
Okay, you guys have a great weekend. Good to see
Thank
everybody
you.
today.
Have a great weekend. Safe
Bye-bye.
travels.
Bye.
Bye.
Bye.